Have you started going through the menopause transition or the perimenopause transition, and all of a sudden, on top of your other symptoms, you have found yourself having pain with intimacy? So the first thing I want you to know is pain with intimacy is common, but not normal, and absolutely something you shouldn't have to live with. So first thing is, I want you to learn about hormone replacement and see if it's for you. It may or may not be, but become a hormone replacement aware and educated person and find a provider that is as well, so they can give you the facts. But for right now, I'm going to give you 5 tips that you can do right now so that you can get back to enjoying intimacy. 1 is use lube. Use it. When we are in perimenopause or menopause, we lose estrogen. And when we lose estrogen and those levels decline, our vaginal tissues can get dry and thinner and cause pain with intimacy, and sometimes even cause irritation and tearing. Adding that moisture back is a game changer. We're gonna have a separate video on what kinds of lube to use because the options are many. But for right now, add moisture back in. Lube should be your best friend. Number 2 is I want you to do pelvic floor relaxation exercises because we want to release the tension in the pelvic floor. Go ahead and see my video on reverse Kegels, which is a pelvic floor relaxation exercise on YouTube that may help you. So lube, add it back in, your best friend. Do pelvic floor relaxation exercises. I want you to practice diaphragmatic breathing. Diaphragmatic breathing is the best way to release tension and restore the tone in your pelvic floor muscles. I have a whole series on this, and I want you to go ahead and watch it if you're not familiar. And then the 4th thing is I want you to stop doing Kegels. I know that in perimenopause and menopause, we've been told that our muscles can get weaker, and that's true. But when you have pain with intimacy, that may be an indication that you have pelvic floor tension. And in order to overcome that pain right now, we want to do relaxation breathing and not do Kegels so that we can help those muscles relax. We cannot help a muscle relax if we're constantly doing Kegels and tightening them. We'll get to that later when you overcome your pain. And then lastly, and just as importantly, I want you to find ways to manage your stress. I know we all have stress, but the sad truth is that stress in our lives can increase tension in our pelvic floor muscles, and that will not be your friend if you're experiencing pain with intimacy. And of course, you do not have to navigate this alone. Find a skilled pelvic health therapist that can help you navigate through this. There is a way out. You're not alone. We can help you. You got this. There's no reason why you can't take control of your menopause transition and feel amazing and vibrant. If you haven't already, please go ahead and subscribe, like, and follow so you don't miss any other amazing videos. And of course, leave me your comments below so I can answer all your questions.